Mr. President, there was debate on the Senate floor that went on for years, and it was a personal thing, a personal issue to two senators. One was a Republican, the other a Democrat. The Republican was Senator Pete Domenici of New Mexico, and the Democrat was Senator Paul Wellstone of Minnesota. The two of them had teamed up with a very simple goal in mind. They wanted to make sure that every health insurance policy in America covered mental illness. When you think about the fact that 50% of Americans suffer some form of depression and that mental illness is something that every family, most every family, faces at some point, you wonder, well, why didn't the health insurance policies cover mental illness? Well, the reason, of course, was that it takes some extended care for the mentally ill in some cases. In other cases, there was an argument made you won't find a cure. But things have changed a lot in the world of mental illness over the last few decades, and changed for the better. There are new medications that are available and some even better ones on the way. There's new treatment available and more hope for people. Well, Pete Domenici, Republican, New Mexico, and Paul Wellstone, Democrat of Minnesota, didn't give up. They insisted on it, and they won. They won with the requirement that health insurance policies cover not just mental illness and treatment, but also substance abuse treatment. I'll be honest with you, I followed that debate closely. I didn't pay that much attention to the substance abuse treatment part of their effort. Now I have, and I think many people across America have. There was a supplement in the Chicago Sun-Times this morning, published by the USA Today. It's entitled, "Obamacare Repeal Jeopardizes Mental Health and Addiction Coverage." I tore it out of the paper on the airplane to bring it to the floor of the United States Senate because this is a good day for us to reflect on what this article has to say. We are now in the midst of a budget resolution effort that is designed by the Republican majority to repeal Obamacare. The Republicans hate Obamacare. They hate it almost as much as the devil hates holy water. They have tried for 6 years to repeal it with a singular focus. I don't know how many times they voted in the House. Some said over 60 times to repeal it. They've said that for so many years, and we've said to them, what will you do after you repeal it? And they said, well, we've got a plan. For 6 years, they've said, we have a plan to replace it. We've never seen it. No one's ever seen it. It raises a question about whether they do have a plan. They certainly have a plan to repeal it, but when it comes to replacing it, they don't offer anything. But they're going to go ahead with it. They are bent on doing this regardless of the outcome. And for a lot of people across America, this could be devastating. This article talks about a family in Kentucky, the home state of the Republican leader, Melissa Fleckinger of Edgewood, Kentucky. She had to pay for heroin treatment for her daughter, Amanda, before the Affordable Care Act. Her son Brian's treatment for heroin addiction was covered by the ACA, but unfortunately he died of an overdose in 2015. This article goes on to talk about what it means to have children who are addicted to drugs and parents who are desperately trying to find treatment. And some of the things that are said in the course of this are really worrisome, because this article spells out what happens to families without health insurance to cover substance abuse treatment. They become helpless, unable to take care of their kids. Now the Republicans have come back and said, we'll just do partial repeal of the Affordable Care Act. Listen to what this article says. Almost any route taken on Capitol Hill leads to an unraveling of addiction and mental health coverage for those people. Even the partial ACA repeal Congress is considering would eliminate the tax credits that reduce the premiums for about 85% of the people who buy insurance on the exchanges. Most of those who get tax credits pay less than $100 a month for health insurance and have very low out-of-pocket costs that make it possible for them to afford coverage. What they go on to say here is putting a requirement in the health insurance policy that it cover mental health, illness, and substance abuse treatment means nothing if the people can't afford to pay the premiums for the health insurance policy. So the Republican plan that would eliminate the tax credits that families need to be able to afford the policy means that there's no way they're going to get coverage for themselves and their kids. Who's going to be affected by that? Well, I'll tell you what I found in Illinois. What I found in Illinois is that the current opioid heroin epidemic is everywhere. There is no town too small, and there is no suburb too wealthy to avoid it. Story after story of teenagers and young people addicted who have no place to turn. And if the Republicans have their way in the Senate and the House, they will close the door for many of these young people. I see my colleague from the state of New Hampshire here. I was stunned to read, I don't know if it's still the case, but I was stunned to read several months ago that when you look at the average number of deaths from opioid and heroin across the nation, and Illinois is, I'm not making any excuses here, we're average. The rate of death for heroin opioid overdose in West Virginia is twice the national average, and the rate in New Hampshire 3 times the national average. Listen to what the repeal of Affordable Care Act would mean in New Hampshire. And I might say to the senator from New Hampshire, she's quoted in this article, repealing the ACA would cause in New Hampshire nearly 120,000 people to lose coverage in that state, where federal data shows a nearly 200% increase in overdose deaths in the past 5 years. More than 48,000 Medicaid claims were for substance use disorder in 2015, making an ACA repeal, in the words of Senator Shaheen, literally a matter of life and death. Ohio. At the Cincinnati Center for Addiction Treatment, CEO Sandra Keene said about 30% of Keene's patients are covered for treatment because of the expansion under ACA. Overdose deaths in Ohio climbed from 2,531 in 2014 to 3,050 in 2015, up more than 20%. Kentucky, the home state of the Republican Senate leader. Overdose deaths here totaled 1,248 in 2015, up 17% from the previous year. Fentanyl, stronger than heroin, was involved in 420 fatal overdoses in 2015, an increase of 250% over the previous year. The lady who was quoted earlier, who lost her son to the overdose, wasn't surprised. She knows several other people who've overdosed and many others who've died, including one last week. Chicago, we're proud to represent it, but up to 30% of the 9,000 prisoners at the Cook County Jail have a diagnosed mental illness. The ACA has been a game changer for those who are in and out of Cook County Jail, said Mark Ishog, CEO of Thresholds, a Chicago treatment provider. It costs less than $20,000 a year for Threshold's highest level of community-based mental health care with a housing voucher. $20,000 a year, less than that. You know what it costs to incarcerate that same person? $70,000 a year to incarcerate them. About a third of the patients being treated by Thresholds are covered by the Affordable Care Act. What's the alternative, I say to my Republican friends? They can't wait to repeal this, but they don't have an alternative. Meanwhile, in Illinois, in New Hampshire, in Maine, in every state in the nation, mental illness is still a challenge, and substance abuse is on the rise, and people are dying from heroin and opioid overdoses. This is the height of irresponsibility, to repeal this measure with no replacement. It is sad to say we've reached this point, that a political score has to be settled now that the Republicans are in control of the House and the Senate, now that they have an incoming president. The Republicans finally get their day. Someone said to me, why is public sentiment starting to change on this issue, and even among Republican politicians? And I said, they've been saying irresponsible things for a long time, but now people are taking them seriously. And as they take them seriously, they realize what a devastating impact it's going to have. Nicholas Kristof wrote in the New York Times last week, if the Republicans ran a home renovation business, they would start tearing down your roof this month and promise to return in 2019 with some options for a new one, if you survive. Last week, Senator Rand Paul of Kentucky wrote an op-ed arguing that repeal should not be done without simultaneously being replaced. Senator Bob Corker, Republican of Tennessee, has said that repealing the law without replacing it is, quote, a flawed concept, and that having a replacement ready first would be a more, quote, prudent approach, in the Republican senator's words. Senator Susan Collins, Republican of Maine, has said she'd like to see, quote, detailed framework, close quote, accompanying any repeal. Senator Tom Cotton, Republican of Arkansas, said, quote, I don't think we can just repeal Obamacare and say we're going to get back with an answer 2 years from now. Over and over again, these Republican senators are realizing how totally irresponsible it would be if we go forward with this proposal. And I'll tell you what troubles me as a representative of a state that has the great city of Chicago and a wonderful metropolitan area, but I come from the other end of the state, the rural part of our state. I wonder what's going to happen to our rural hospitals if the Affordable Care Act is repealed. I think about Franklin Hospital in Benton, Illinois, population 7,300. Hospital's been there 60 years. For the past 15 years, it's been teetering on the brink of bankruptcy. It all changed 6 years ago with the passage of the Affordable Care Act and the expansion of our Medicaid program in Illinois. Because of those changes, Franklin Hospital found that they could survive. Expanding Medicaid cut Franklin Hospital's uncompensated care in half. In Franklin's emergency room, they saw 600 fewer no-pay patients and 428 more Medicaid patients compared to a previous year. This, combined with increases in Medicaid funding, allowed Franklin Hospital to invest in much-needed improvements and to consider bringing nuclear medicine and a retail pharmacy to Benton, Illinois. What does that mean in that city? Well, it means all the difference in the world. There's something else that has to be said. If that hospital, Franklin Hospital in Benton, closes, it won't just mean a longer drive for critical health care. It's going to mean the loss of 4,300 jobs. 4,300 jobs in Benton, Illinois. So when the president-elect talks about saving 600 or 800 jobs, Carrier Corporation, good. I'm glad. But then for his party to turn around and to pass a measure which could kill 84,000 to 95,000 jobs in Illinois is a move in the wrong direction. I say to my Republican friends, go home and talk to the people you represent. Listen to what they have to say about what we're doing, facing addiction, mental illness, and rural hospitals who are on the brink of closing if you have your way politically. This is no victory for the people of America to repeal the Affordable Care Act without a replacement that's as good or better.